I am Dr. Mitsuko Takahshi. A lot of people call me Dr. M. I am a cardiothoracic surgeon.
What is a cardiothoracic surgeon?
Cardio means heart, so cardio. And then thoracic means chest, so is lung. So we operate on mainly everything that's in the chest, which is kind of like the heart and lung.
Is everyone's heart the same inside?
Yes, isn't that amazing? So it doesn't matter if you're Asian or white or black or Hispanic, all of our hearts are pretty much the same on the inside and pretty much all the same color too. And we all have the same basic blood vessels and we really look the same on the inside. It's really amazing.
How does the heart work?
The heart just works. I don't know how I can explain it better. It just doesn't stop working until we pass away. It just, from the very, very time you're in your mommy's tummy, it just starts beating and beating, and it keeps beating and beating the whole time. It just does it. It just knows that that's what it's supposed to do.
How do you replace the parts that are broken?
You actually have to cut them out, and then you remove it, and then you put a new piece in, like a valve, like I showed you here. So you have to cut out the old one. So we have to we have to cut a part of the heart, and then you have to make a cut, and then you have to pull it out. You have to cut it out, and then we put this new one in there, and then we have to sew it all back together so it doesn't leak all sorts of blood everywhere. So that's called a replacement.
What does an operating theater look like?
This is like what an operating room kind of looks like. So every operating room has a table. Okay, so that's where the patient sleeps, and there's a pillow there, so that's where their head is. And all of the operating rooms have lights on the top, and then you kind of shine them on the patient. And most operating rooms have these extra screens so you can see their x-rays and their CT scans. And then there's a separate doctor from the surgeon that sits over here by the head of the patient, and they're called the anesthesiologists. And they give the patient the special medicines to make them sleepy so we can operate so they don't have any pain and they don't remember anything.
What tools do you use for your surgery?
Kind of like the suture that we use. There's a big needle, okay? And then the suture is kind of it's pretty thin. It's kind of like yarn. And then we get these special instruments, this is called a needle holder. And then we put the needle in it like this, and then you sew. So it's different from the needles that maybe you see when you're sewing a shirt or something, or a sewing machine. So we become the sewing machine, and we use the turn of our wrists and our fingers. And then you usually use some kind of what we call a forceps. This is called a Deigo, and then you kind of take it, and then you take it with your other hand, and then you turn it around, and then you take it again, and then you sew again. When you're training, you're constantly trying to tie, and I can show you so I made a model in case you need this. So you take things like this, and then you sew them together, or you grab anything, and you take suture, and you tie, and you tie, and you tie, and you suture anything that you can get your hand. I'm gonna show you guys, sometimes we have to wear some crazy glasses. So these are my regular glasses. And then I have these other glasses. So these glasses have magnifying glasses. And some surgeries I have to wear these ones, okay, where the magnifying glass is a lot longer, and it's 3.5 times bigger. So if the artery is only 2 millimeters, it looks like it's at least 7 to 8 millimeters when I look through these glasses. So it looks like this. Looks pretty crazy, right?
Yeah. Wow.
And I can see you guys really big.
How do you not get grossed out?
I don't know. I think it's just so cool. It doesn't seem gross to me. It's just such a cool thing. It's cool to be able to watch the heart, and then when we operate on it, we stop it temporarily so we can operate on it, and then we restart it again. And same thing with the lungs. You're able to stop them temporarily so you can operate, and then you turn them back on, and it's amazing. It's amazing stuff.
How do you become a cardiothoracic surgeon?
Becoming a doctor takes a lot of time, but you guys can do it if you want to. So you definitely have to finish high school, and then you definitely have to go to college. Okay, so and you have to go to college, and you have to finish 4 years of college to get something called a bachelor's degree. And then you apply to go to medical school after college, and medical school is usually about 4 years. And then, so medical school, you get your general medical training, and then you become a doctor when you graduate. But then you have to choose what kind of doctor you want to be. So if you want to be a surgeon, you have to go to special training. It's called residency. So you have to go to surgical residency. But you're a doctor now, but you're a very new doctor. You're like a baby doctor. So surgical residency is usually about 5 years. And then you learn all the things that a general surgeon can do. And then if you want to do something else besides general surgery, like I wanted to do cardiothoracic surgery, I have to go through more training. It's called fellowship, and that's another 2 to 3 years of specialized training just on the heart and the lungs.
What made you decide to go to medical school?
My journey was a little bit different. I didn't know that I wanted to be a doctor from a young age, but I knew that I wanted to be something in healthcare. And then probably when I was in college, I was kind of like looking into all sorts of different kinds of health. There's all sorts of different kinds of doctors too. There's like Chinese doctors like that do Chinese medicine, and then there's Western doctors that get an MD degree and a DO degree. And I think it was in college that I kind of decided that I was going to be a doctor.
What classes would you have to take in high school?
In high school, you just take all the regular classes that you normally take. But in college, if you do think you want to go to medical school, you are going to be required to take a certain number of science classes, like biology and physics and chemistry, that you're going to have to do because it's going to be on your exams. So it doesn't mean that you have to be like a science major. You could be any major that you want to be. But you do have to make sure that you take those classes so your school doesn't become too long, and that you have the appropriate background so you can pass the tests.
Is it difficult to do those surgeries? Do you need to be physically fit? Is it difficult if you're a girl or a boy?
Obviously be physically fit because as surgeons you're going to be standing a lot. Most surgeons have to stand for their surgeries. There's some surgeries where you can actually sit the whole time, which is kind of nice. But most surgeries you have to stand. So when you have to be able to stand for long periods, but that doesn't require too much energy or stamina, right? Like you're just standing, but your legs can sometimes get tired. I'm pretty short. I'm only 5 foot. A lot of my patients are really big, and I can still operate on them, but sometimes I need to stand on an extra step stool because I'm too short. And it doesn't require strength to operate on them so much. Sometimes at the end, to maybe bring all their tissues together, we need a little bit of strength, but it's not that much strength, more than what you would need as a female.
Who or what inspires you?
I think a lot of people inspire me. I'm inspired every day by our patients that have the courage, that are going through some major illnesses, and their courage to go through them. I do have one person that I call a mentor in my life. His name is Daisaku Ikeda, and he's a philosopher. And he has always been a big believer that we can always do anything that we want to do, anything that you set your mind to, but you have to do a lot of hard work to happen. And he always believes that everybody can do anything that they want, no matter what. Hope that you guys always feel that you can do anything you want to do, but it could take a lot of hard work. You have to be willing to put a lot of hard work into it, but just set your mind to it and you guys will be able to do it. It doesn't matter if you're a boy or a girl. If you want to be a doctor, you can be so many different kinds of doctors, and it can be so much fun, and you can help so many people, but it could require a lot of hard work. So as long as you do it for the right reasons, it's going to be a wonderful job and a wonderful career.
Yeah.
You guys ready?
Yeah.
You want to be doctors?